Well, good afternoon, folks. Thank you for joining us. My name is Michael Tipton. I'm the president of the Blue Cross and Blue Shield of Louisiana Foundation. We are glad you all are here. At least on my end, it's a rainy day in Baton Rouge. I hope it's okay where you all are. A couple housekeeping items and logistics, and then we'll dive into our substance today. In terms of housekeeping items, you all, I'm sure by now, are very familiar with all different online platforms, but Zoom has all the normal mechanisms you'd expect. We would encourage you to chat your questions as you have them. For those of us joining on Facebook, please comment your questions. We'd love to see them, engage with us throughout the way. And certainly please know that these sessions are being recorded for folks to follow up and engage with later. On that recording point, I just acknowledge that when we set the dates of these sessions a number of weeks ago, we were certainly not hoping for a hurricane like Hurricane Ida a couple weeks ago, or Hurricane Nicholas that's causing rain throughout South Louisiana and potential flooding. Obviously, there's an ongoing pandemic and all the challenges with it. So we know that many folks are not able to be on hand with us live today, and that's okay. That's part of why we were recording these sessions. And we recognize the impacts of healthcare human capital and the topics we're going to be talking about today on everything that we are all doing. And certainly that is part of why we at the Blue Cross Foundation have made substantive commitments to addressing the short-term needs of hurricane relief like Hurricane Laura last year, Hurricane Ida, and the ongoing pandemic. But it's also why we are here today to talk about healthcare workforce. As you all have seen, prior to the pandemic, finding a doctor or a nurse or a mental health provider in an area of need was a real challenge. And that has become even more so in light of COVID. That has become even more so in light of hurricanes and natural disasters. It's really been an unrelenting 18 months leading to many people burning out, facing new challenges on top of all the ones that were there before. And so that is what brings us here today, coming from a standpoint that we at the Blue Cross and Blue Shield of Louisiana Foundation are really interested in trying to improve the wellness and well-being of people in our state, and certainly having access to the healthcare people and providers that are needed is a critical part of that. If we could pull up our pipeline graphic, just to set the stage for today, what we are going to be talking about today is one part of a four-part series. Each Tuesday at noon in September, we're going to be talking about how healthcare human capital aspects relate to each other. Last week, for those who joined us, we set the landscape. We heard from a federal leader at the Health Resources Services Administration, Hpsa, that oversees healthcare human capital in the United States, to look at how Louisiana ranks, how the United States ranks, and certainly where there are areas of need. For anybody who missed, you can watch that on our Facebook page. This week, we're going to be talking about the graphic you see on your screen. When we talk about healthcare human capital, we frequently talk about it as a pipeline or a funnel, that someone goes from a standpoint of being interested in the healthcare human capital role, goes through applying and getting into a particular program, goes through that program and gets to graduation, graduates, get their needed certificate, and then ultimately gets hired and hopefully serves where they are needed. That pipeline at its best is a funnel, and certainly we know that folks don't go through all of those steps. People make other choices and go into other roles, and that's fine. But when we think about this as a pipeline, we also recognize that it is certainly not doing all the things that we need it to do. There are gaps in that pipeline where folks who might be interested in serving are otherwise not getting through. And that's a lot of what we're going to talk about today. And there are also issues with the fact that frequently we aren't getting all the applicants we need. We're not getting the diversity of applicants we need. We're not doing all the things we need to do to help get people through those steps and processes. And that is really what is bringing us to today, looking at those pipeline issues. To preview the next 2 weeks, next week we're going to be talking about the interconnectedness of these issues, how what we're talking about today relates to funding, diversity, working in systems and silos that often don't work together. And then 2 weeks from now, for our final session, we're going to be talking about examples of cross-sector partnerships, breaking through these issues and hearing some reflections of our industry and state leaders for how we can do better in these spaces. I should note before we dive into today's session, after today's session, you're going to be having the opportunity to give us some feedback. We'll be dropping a survey into the chat. We certainly hope you will engage with that and give us some good feedback. And then after our final session, we'll invite you to follow up with us and with partners to engage with each other by topic and by geography, to engage around these issues. Certainly, having the healthcare human capital we need, having the great people we need to serve in hospitals and doctors' offices is of interest to all of us. And that is what's bringing us here today, to hopefully think about ways that we can all work together to address these important issues over the long run. So without further ado, I would encourage you certainly to visit our website, bcbslafoundation.org, for more details. And otherwise, let's dive into today's topic. Today, we're going to be hearing from 3 promising examples of innovation related to the pipeline, that graphic I just showed you. We'll introduce each one as they come, and then we will have a few minutes to ask and answer questions on each of these topics before going on to the next. At the end, hopefully, we're going to have time for questions for each of our speakers, and then we'll wrap up with some closing announcements. Our first topic that we're going to talk about today, and our first speaker, really speaks to the very beginning of that pipeline, the talent attraction and identification, and getting the right folks involved. Today, our first speaker is Ali Diefendorf. Ali is the director of underclassmen learning with the Baton Rouge Youth Coalition, a nonprofit in Baton Rouge that works with high potential but under-resourced young people and helps get them the supports that they need to get into and excel in college and beyond. The Baton Rouge Youth Coalition recently created a Health Fellows program to partner early and identify kids who might be interested in pursuing healthcare careers, to partner them with mentors and shadowing and learning opportunities, to partner them with scholarships and additional resources to explore those roles. BRIC is partnering with the Baton Rouge Youth Coalition, which is a multi-specialty clinic in Baton Rouge, to do some of this work, and more recently has partnered with our team at the Blue Cross Foundation and colleagues at Blue Cross around this work as well. With that, Ali, I'm going to turn the floor over to you. Thank you for being here. Take it away.
All right, thank you, Michael. Thank you all for giving me the opportunity to share a little bit more about Health Fellows with you. I am Ali Diefendorf, our Director of Underclassmen Learning, and I am leading our Health Fellows program this year. I always say if I was not in education, I'd be in healthcare. So I'm especially excited for an opportunity to work alongside and learn from our partners this year at Blue Cross Blue Shield, Baton Rouge Clinic, and our newest edition of Fran U. So we started out just last year in 2020 as the pandemic and social unrest were raging. The Baton Rouge Clinic's top tier leadership reached out to Lucas, our top level leader, and asked about how they could get involved with supporting underserved students of color who aspired to be healthcare professionals. They wanted to start their own program and do it at a college level, but Lucas talked them into focusing on earlier access and just plugging into BRIC's already existing infrastructure. We didn't talk about financial support at all, just really piloting this healthcare focused program. Our program is seeking to address a number of issues. We have 3 here: economic stability, social and community context, and healthcare access. In terms of economic stability, thinking about ways both that include and go beyond what the Department of Health and Human Services recommends, including providing career counseling from 9th grade through college, and offering scholarships to increase financial margin for health care related expenses. Addressing social and community context, we know that Black and Latinx underrepresentation among U.S. physicians and nurses is really instructive for understanding the broad lack of access to healthcare fields that our Health Fellows program seeks to address. The American Association of Medical Colleges shares that just 5% and 5.8% of active physicians are Black and Latinx respectively, while white physicians comprise more than 56%. And the Minority Nurses reports that Black and Latinx registered nurses comprise just 9.9% and 4.8% respectively of their fields. And then finally, in terms of healthcare access, something that we're actually really proud of and doing at BRIC, right now is offering free mental health counseling and promoting its use. We know the pandemic's impact on mental health is infamous, but the utilization of BRIC's counseling service has dropped 35% since March. And after returning to in-person, we hope to mitigate this decline. So looking at the need, we know that there are a number of reasons we need our Health Fellows program at BRIC and beyond. Right here, we have just naming a few, healthcare workers, as Michael just shared, in incredibly high demand, more than ever. For our younger fellows, understanding that healthcare, it does not just mean nurses and doctors and what we see on Grey's Anatomy. One of our biggest ones, again, that Michael just shared about too, lack of diversity in healthcare, and then disparities in healthcare human capital. Right now, we know that our alum become doctors and nurses at rates of less than 1% and less than 5% respectively. And the Health Fellows program is seeking to demystify the practical steps for pursuing these and other healthcare professions that connects our college fellows and current fellows to a network of people of color in this space. Right here, we have Hpsa, who is going to graduate this year with a master's in clinical mental health counseling. And then the how, as you may have guessed, we are starting to address this need through our Health Fellows program in partnership with Blue Cross Blue Shield, Baton Rouge Clinic, and Fran U. Starting next week, our Health Fellows will apply to the program. And then beginning in October, we'll offer monthly professional development through a variety of lenses as a way to increase healthcare human capital, address healthcare through lens of social justice, and provide our fellows with opportunities in and knowledge about the healthcare world that can otherwise be incredibly difficult for them to access. We have a number of goals this year. We know that the Health Fellows program is very new to BRIC, but have seen amazing opportunities with it, and then also lots of potential for growth. So we are have some lofty goals this year. We're identifying different fields and professions that exist in healthcare. Again, just outside of just nurses and doctors, discuss ways that fields converge to provide care to patients. So we know Micah Cooper here is at Emory pursuing a medical school, and thinking about how Micah and Hpsa 2 slides ago can merge to provide care to patients and their community, gaining insight on how various professionals found their niche in healthcare, and understanding it's okay to hop around, and you likely will be hopping around, understanding healthcare through a lens of social justice, exploring fields of interest. And really excited about that too, to sort of explore fields before they may have had opportunities starting in college, and then develop self and community advocates. This is always one of our goals at BRIC. And then longer term, again, have seen incredible growth in already just a few months of the Health Fellows program. And so really excited for its infinite opportunities this year. And long term, we're hoping to, as always, provide mentorship opportunities for our alum to mentor current fellows, decrease disparities in healthcare professions by decoding hard to access information and providing exposure to various opportunities. Again, just like getting, sort of tackling those practical steps and getting into the healthcare world. Creating accessible pipeline. This is the big one for BRIC fellows interested in pursuing healthcare, and then developing our humans first and healthcare professionals second. I think I have a few extra minutes here, just really quick, just want to share with you a little bit about BRIC right now. Last year, we had 235 students in 30 schools and 9 districts. This year, we are at 319 with, we're in 45 schools, 13 districts. A little breakdown here and a little bit more about what persistence looks like for our fellows. I'll give you all an opportunity to sort of check that out. I will pause my screen share, and if there's time, we'll take questions. If not, I'll take questions at the end.
Thanks, Allie. I do think we have a couple minutes for questions. There's one that was dropped into the chat here, and this may be just a matter of the pictures that were highlighted, but specifically a number of the fellows seem to be African-American female or female. Is there something that may be hindering males, or particularly African-American males, from accessing medical fields? Is that something you all are exploring or thinking about?
That's a really great question. I do think that it might have just been the pictures that ended up there, but we are opening and offering our Health Fellows program, encouraging all of our fellows who express even a tiny bit of interest, or maybe maybe haven't even really thought about healthcare, encouraging them all to apply. I'm actually thinking of a handful right now, and I think we have more males than females interested in the Health Fellows program this coming school year.
Thanks for answering that. I see we've got a bunch of introductions going into the chat. Thank you for that. Please keep them coming. One question that I had from listening to your presentation and knowing a bit about the work that you all do, Allie, can you talk a bit about how you think about pairing particular fellows up with particular sets of experiences? So how do we know if somebody's exploring and sort of shadowing a nurse and shadowing a doctor? How do you all think about identification and then partnering folks up with appropriate mentors or shadowing experiences?
Amazing question. And I'm really excited to be able to have the opportunity to do this year, because we do have 3 very different partners. So we will, my goal is that we'll have a sort of choose your own adventure type system this year, where our fellows are being introduced the first few months. Their professional development will look the same across the board, where we're looking at healthcare through a few different lenses, what healthcare looks like, understanding again that healthcare is, there's lots of opportunities. Maybe blood and guts are not for you, but numbers are your thing, or data is your thing, and sort of identifying. Speaking of, that's my insulin pump as we are at our, with healthcare here. So we're looking at through healthcare through a number of lenses, and they will then identify what feels interesting to them and sort of choose their adventure that way and take that path. So there'll be a number of opportunities for fellows to learn about what healthcare could mean for them.
Great, thank you. We've got time for 1 or 2 more questions. There's one in the chat here, which speaks to both, I think, BRIC, but also the specific fellowship. So talk to us about how you're recruiting for BRIC and how you're recruiting specifically for this fellowship. So the question was, do you recruit from high schools? They note here that in Baton Rouge, Glen Oaks High School has a medical curriculum and program. Certainly there's folks from throughout the state that are listening. So speak to us a bit about how you all find BRIC fellows, but specifically how you think about this program fitting into that.
Great, yeah. BRIC fellows come from all over. We have, again, I'll reshare. I'm gonna reshare for you here. Here's this year. We have fellows from 13 different districts, 9 private, 4 charters, and then those 2 with homeschool. So we have an amazing recruitment team, and they are going into our schools, both middle and high schools, to recruit fellows for BRIC. BRIC fellows do need to be in really great standing. So we do hold our fellows to high expectations in terms of grades and attendance. So as long as they are meeting those and we are putting supports in place for that, they are applying to BRIC from one of our 45 different schools. Again, that has really grown, especially now that we have the opportunity to be virtual. So this school year, Mondays and Tuesdays, hoping that we can go back in person, but once we can, Mondays and Tuesdays will be in person, Wednesdays and Thursdays are virtual, so we can keep those fellows that we got from Mississippi last year and further in Louisiana. And then in terms of health fellows, what happens is we will spend the next few weeks recruiting during programs. So they'll hear about it from their program managers. They'll get a script. The program managers will get a script. And then I will also be reaching out to specific fellows. I have a few in mind who are actually already incredibly involved with healthcare on their own. One who is EMR certified and has a CNA. And so I'm going to be really leaning on them to sort of help with recruiting their peers as well.
Well, Allie, thank you very much for sharing about BRIC's great work with the Baton Rouge Clinic, with Fran Yu for Health Fellows. We will hopefully have some time for additional questions here at the end. But in order to get to our next speaker, we're going to go ahead and transition and just say thank you for sharing about the great work that you all are doing.
Thank you.
So next up, we're going to be hearing from Dr. Sarita James of LSU Alexandria. Dr. James is Assistant Director of the School of Nursing. And we've asked her here today to speak about some of the unique ways that LSUA is addressing some of the needs of students in their programs. As we all know, getting to college and getting through college can be a challenge under many circumstances. And certainly when we think about the non-traditional student, the student who may have kids at home that may be juggling a job, those challenges get all the more complex. LSUA has some great experience with that throughout their history, and particularly as they are trying to meet the healthcare needs of Central Louisiana and throughout Louisiana, they've made some really innovative changes here in the last number of years to address those challenges. And we wanted them to be able to highlight that great work today. And hopefully it proves to be insightful for all of you as you think about that middle part of the pipeline, how we get folks who've applied to a program through that program and through to graduation. So with that, Dr. James, thank you so much for being here today. The floor is yours.
Thank you very much, Michael. I appreciate the opportunity to be with all of you today and to share all the wonderful things that LSUA is doing for our students. We, for many years, have focused on our students to help them be successful. And for the last few years, we have felt like that we needed to move along and try to work more toward what our demographic really is. We still have a very high female population here at LSUA. Right now it's running at about 96%. We're trying to get more and more males. I am excited to say I have about 5 males in my class right now. 52% of our students are actually first generation college. We have 45% of individuals of color. 8% of our students are working over 40 hours a week, and 23% of them are still working between 20 to 40 hours a week and coming to school full time. 56% of our students have children at home, sometimes 2, 3 children, and some of them are also the primary caregiver of a family member or a grandparent. So we were identifying that we really needed to change because our program is really fast. It's 4 semesters, 16 weeks each. We start every fall and every spring, and we were admitting 60 students. And our content was very, very heavy. It was based on the medical model, and we were having low pass rates and low retention rates because our students were unable to manage. So we started evaluating our curriculum and decided in 2016 we really needed to go to a more concept-based curriculum where students were able to manage a little bit better both at home and at school. And we were also needing to meet the need of our community. We were starting to see there is a nursing shortage, and as Michael was saying, with COVID, our medical community is getting tired, and so we received a request to try to see what can we do to initiate more healthcare providers in the workforce and more quickly. So to provide that academic support to help students achieve success and get to graduation. So our concept-based curriculum does help students manage the nursing program better and helps them to meet success because we use more innovation. We're starting with our partners. We were able to hire an additional faculty member so that we could increase our admissions to 70 each semester. And we have just implemented our 4th semester of the concept-based curriculum this fall. We also added a pre-nursing course. We started in the fall of 19 because we were finding students just really didn't know what nursing was really all about. Some of them were coming in from high school thinking, hey, nursing sounds good. You can make a good paycheck, and not really understanding what the role was. So we now have 4 full sections of our pre-nursing course. We still continue our peer mentor program because we find that students relate better to their peers than they do sometimes to their instructors to help them coach through their simulations, through their practicums. And we just started a student success coordinator, which has been a welcome change, who meets with all of our students. And I'll talk a little bit more about that in a second. We continue to work with our high schools. We started this summer with a Future Nurses Camp. they were here for a week and they were wishing they could be here for another 2 weeks because they had a lot of great experiences and could see the various roles of nursing. We continue to participate with AHEC with high school students, and we have them over to the school every December for those who are interested in healthcare. And we have found that the anatomy and physiology, that's the general education anatomy and physiology here, may not be geared more toward the student who's interested in nursing. So we are collaborating with that department to see if there's a possibility that anatomy and physiology could be geared more toward a nursing and allied health student to help them. With our partners, we were able to fund our student success coordinator as a full-time position. For our students, many of them have financial burdens. So with $80,000 in new scholarships, many of them have been able to stay in school. And with the onset of COVID and having to rapidly transition to the online environment last year, we were able to improve on our learning resources and put in some additional resources to help with remote learning and online testing. And that even included virtual simulation, because many of our students had to pull out from clinical last semester. So my being able to bring them through virtual simulation and clinical experiences was a great help. COVID impacted our students greatly, having to switch in 2 weeks to go to online school. A lot of them experienced family loss. It just was more added stress. Some of them lost their jobs. They needed some help with managing school and family and trying to adapt to remote learning, but our students were very resilient. They held on fast. They often meant that they experienced more increased appreciation for the nursing as a profession whenever they were able to go back to clinical and see the dedication of nurses in our area. So I'm happy to say in fall of 19, our first semester students, we would take an intake of between 60 to 65 students and only have maybe 60% of them move on to the second semester. With our concept-based curriculum and our pre-nursing course, we enrolled 74 students in the spring of 20. 79.2% of those students passed, and many of them are still active in the curriculum and are still doing well. Our student success coordinator starts workshops in the pre-nursing courses, and she has started having Tuesday talks where she invites every course to come in and give her ideas of where their learning needs are. 100% of our at-risk students are contacted by our coordinator, and our faculty are also engaged with her, and we also offer review of exams. We provide them with progressive skills fairs to help them with their skills in the clinical setting. We offer simulations, and we also continue one-on-one counseling with our students to help them be successful. All of those who are declared nursing as a major, they are required to take the pre-nursing course. And our peer mentors are available through all of our sections 1 through 4, and they help every student. And we do require every student to have at least one session with a peer mentor to prepare for their practicums to help them be successful. This is our student success coordinator. She gives individual and group workshops for study tips, to help them with time management, taking notes, getting ready for an exam, helping them learn how to learn, because a lot of our students do not know how they learn best. And there is an ongoing relationship with these students to help them stay on their plan, and she follows up with them very readily. So as I've already mentioned, coaching, I've already mentioned with our peer mentors, our labs are open, faculty are up there to help students with their deficits, and our success coordinator also coaches our students to help them if they have trouble with math, with their dosage and calculation exams, how to navigate the online testing, and she celebrates with them. She calls them up and talks to them whenever they've had a pass on an exam. She sends them encouraging notes, and this is very important to those students, especially those who are having to juggle family and work. And we still do reach out and collaborate. Our advisory committees for our area healthcare community is very important. And we maintain that relationship so that we can identify any opportunities that we can help improve our program for student success and get those students ready to get into the workforce. Our coordinator, if she identifies there's a financial problem or an emotional problem, she reaches out to our services that we have available here on campus. And I've already mentioned the Tuesday talks. Those are very important. They let us identify if there's any enhancements that we need to do in our courses. And we continue to collaborate with our general ed departments to make sure that the courses that our students are required to take in the general education areas are still meeting our needs. I'm happy to say, hopefully by the end of this semester, we're going to have 48 students who will be graduating. This is 65% that have been retained from their first semester in our new curriculum. 67% of the students who were on an academic plan in the spring have followed their plan, and they've met success with our coordinator. We've got multiple stories of improved exam scores, multiple stories of how well they are doing with the student success and with their coaching with the peer mentors. And the financial support has enabled them to be able to stay in school, and many of them are now out successfully practicing in our workforce. We have 72 students in our first semester and 4 full sections of pre-nursing. And so we're really excited to see what's going to happen and how our students are going to progress on to taking their licensure exam. We've got a 94% pass rate. And so we're excited to see if concept-based has helped them in that regard. And so I'm going to stop now, and I would love to entertain any questions that you might have.
Thank you, Dr. James. One question that's come in here. Talk to us about the startup costs and barriers for doing this work. Obviously, this sort of goes above and beyond what folks think of as traditional higher ed, and yet it's getting good outcomes. Can you speak to us a bit about what were maybe some of the barriers that prevented this from happening, and how did you all begin to tackle those issues?
Well, some of the barriers were having enough faculty to actually put this into place, because we started in 2016 and we started mapping it out because naturally putting in a new curriculum, we had to run 2 curriculums at the same time. So part of the barrier was having enough faculty and determining just exactly when the major need was going to be, and it was going to be in the 3rd semester. So our partners that reached out about the same time that COVID was hitting, about the same time the nursing shortage was getting so bad, our partners reached out and said, hey, how can we help? And it just came at the right time to help us hire a new faculty and help us put that student success coordinator in place.
That makes sense. You talked a bit about your various partners, and back on one of the earlier slides, you listed a bunch of different groups. Certainly we at the Blue Cross Foundation have been proud to partner with you all, but folks that range from local hospitals to local industry. Can you speak a bit about that dynamic? Certainly I know a lot of folks who are on with us today represent higher ed throughout the state. They represent, businesses and others. How have you all built this sort of multi-sector partnership in order to be able to do the work that you're talking about?
With us being centrally located, we have a great opportunity because we stay in a very good relationship with both of our area hospitals and with our local industry. And many of those in our that you saw on that slide, many of them are part of our advisory committee, which they are always interested in what's going on at LSUA. Our director is always in close communication with them of what we have going on. And with the nursing shortage, they were all interested in what can we do, how can we help, and to make sure that we get more out into the workforce. And so it's been a wonderful relationship with all of our partners for over the years. And our director has been very key into making that relationship stay very close and very good.
And we got time for one more question here and then maybe a few more at the end. There's one in the chat. What's the background of the student success coordinator? Did they come with a mental health background, a nursing background? How did they get to that role?
Yeah. She is so wonderful. She came to us as a nurse educator with a master's degree, but she had worked for the Hearst Review, which is an NCLEX review company, and she had received a lot of training in test preparation, how to prepare, how to study, how to take good notes. And she is very creative. She will come up with mnemonics. She is just the most creative individual. And she has just always had a passion with helping students how to learn best. And it's just been a wonderful experience with her.
Well, Dr. James, thank you for your presentation here today. Hopefully we'll have some time for a few more questions in a bit, but we appreciate you sharing the great work that LSUA is doing and your team are doing throughout the region.
Thank you for having me.
And to the question that was asked in terms of the student success coordinator, I think that certainly speaks to a topic we're going to be talking about next week, which is the way that these issues all interconnect. There are various silos of work, be they education, or be they counseling, be they mental health, be they financial aid, be they higher ed. And we tend to think of these in separate lanes. And so frequently we know that in people's lives, these issues all intersect. And so finding good people who can cut across those boundaries is a really powerful and necessary thing. Now, for our last presentation today, we're going to be talking about getting licensed. And we are really glad to be joined today by Hope Jones, the Practicum coordinator at Loyola University in New Orleans. Hope's presentation is going to be via video, and we hope she's on the line with us today to answer questions, but certainly also happy to make some connections there as well. Hope, obviously, like many folks in South Louisiana, was impacted by Hurricane Ida a couple weeks ago. She's managing some family medical commitments today, in addition to keeping all the other things going on, getting power back, internet back. So we appreciate her joining us via video to share this important work. As Hope is going to explain in her presentation, most of us tend to think about addressing healthcare human capital needs as simply getting folks through to graduation, sort of get the faculty, get a class, make sure they take the test and graduate, and that's it. But the practical reality is that many folks in healthcare roles, there's a need for mentoring, supervisors, preceptors, some combination of supervised medical practice in addition to in-classroom learning that is needed to get a license and ultimately be of support at the bedside or in a healthcare setting. That is a real barrier in many places in our state, and we are glad that Hope and the team at Loyola are digging into that. So without further ado, we will turn it away to Hope.
It was August 30th, and she complained of acid reflux. She took her prescribed omeprazole and went to bed. August 31st, same complaint, same regimen. September 1st, she was taken to the urgent care with added symptoms of nausea and vomiting, shortness of breath, and excessive sweating. She was immediately sent to the nearby hospital cath lab, her weak body lying on a table with 10 people around her, doing various things, starting an IV, inserting an internal pacemaker, stroking her hand and reassuring her, poking, prodding, and teaching. Yes, during this time of urgency, teaching was taking place. As the family stood outside of those glass windows, waiting and watching, they couldn't help but notice how some of the healthcare professionals were demonstrating actions while others were looking on and listening. Some were providing feedback while others were performing actions, and all were role modeling professional interactions. After things calmed down, 2 people emerged from the room to inform the family that what was thought to be acid reflux was in fact a series of heart attacks, and surgery was needed. These 2 individuals introduced themselves as nurses, the charge nurse and the student nurse, also known as the preceptor and the future licensed healthcare professional. I share this experience because it's true and it highlights the need for and the importance of preceptors and mentors, the impactful role that they play in the healthcare profession, and how preceptors and mentors shape the future of healthcare. Before going any further, let's review some terms to make sure that we're on the same page. Preceptor. A preceptor is an experienced practitioner who provides supervision during the clinical practice and facilitates the application of theory to practice for students and staff learners. Professional mentor. An individual with extensive professional experience that fosters the development and growth of a less experienced individual. Hpsa, Health Professional Shortage Areas. These can be geographic areas like counties or specific service areas, populations like low income or Medicaid eligible populations, or facilities like federally qualified health centers or other state or federal prisons. These areas have a shortage of healthcare providers, be it primary, dental, or mental health care providers. And lastly, practicum. A practicum is a practical section of a course of study. So much like the experience I shared about the cath lab nurses, when we need medical attention, be it emergent or routine, we often don't think about or give credence to what it takes for a nurse or any other healthcare professional to get to where they are in that very moment of providing healthcare for us. Now, don't get me wrong. We all want our healthcare providers to have credentials, and we often do look on the wall to see if they have their degrees hanging, or we look at their name tags to make sure that they have MD or RN behind their names. But we often don't take into consideration what it takes to transition from being a student to becoming a licensed healthcare professional. There are so many steps that a health profession student takes to move from student status to obtaining their license and being able to practice. And there are so many requirements involved. Now, we all know the customary routine of attending class, taking notes, applying what you've learned to a test, and receiving a grade. And I'm not making light of that because it's imperative in any profession. But we also know that one cannot just have book knowledge, but rather it gets real when you put what you know into practice. The confidence can get shattered in the process. The confidence rebuilds, and it continues to build with the more practical experience received and support provided through professional mentorship. Universities, healthcare professionals, and healthcare systems have identified one of the greatest barriers to graduation is the lack of preceptors to fill students' practicum requirement. Nurse practitioner students are required to complete 6 to 8 practicums at 180 hours per practicum in order to earn their degree. In order to complete this requirement, preceptors must be secured to serve as practicum mentors. This form of learning and practice, mediated by a preceptor, is conducive to the development of a critical awareness by the student about reality. Preceptorship bridges the gap between the classroom and the clinical area. I reiterate, preceptors and mentors play an impactful role in the healthcare profession. So why are there not enough preceptors? It all ties back to there being a shortage of healthcare providers. Specifically here in Louisiana, approximately 80% of the parishes are designated as health professional shortage areas, Hpsa, either due to the location or to a high percentage of low-income residents in need of care. Health professional shortage issues are making it hard for patients to actually see a healthcare provider, and this shortage is slated to become worse and more widespread. In fact, the Bureau of Labor Statistics expects we'll see a shortage of approximately 1 million nurses countrywide by 2024. It's only less than 3 years away. Locally, this shortage has been further exacerbated by the state's recent Medicaid expansion, which justly has allowed for more than 433,000 previously uninsured men and women to have health care coverage. Many of these newly covered individuals are getting routine preventive care for the first time. And because of expansion, Louisiana's uninsured rate dropped from 21.7% to below 12.5%, one of the largest reductions in the uninsured rate for any state. Loyola University understands our critical role in addressing the healthcare providers shortage in Louisiana. Our online nursing programs work with students from across the state who return to their communities as skilled healthcare providers. Our goal is to both support our students to finish their education while also preparing them to return to their communities and address shortages by working in communities throughout Louisiana. Here at Loyola College of Nursing and Health, we are working to address the shortage of preceptors and healthcare workers through support from the Blue Cross Blue Shield Foundation by way of the Collective Impact Grant. This funding provides us with the resources to have personnel like myself as the Practicum coordinator go out and develop partnerships with providers to act as preceptors across the state of Louisiana, with a focus on designated Hpsas. By building a database of available preceptors for students to work with, we intend to increase the number of healthcare professionals working in areas where patients face a critical lack of access to healthcare providers. The funding also enables us to offer incentives to registered nurses to participate in this program in a way that is similar to federal funding, programs that provide schools of nursing, nursing centers, academic health centers, and nonprofit organizations with funding to provide training opportunities to nurses. While we have some of these mechanisms in place and we have some other creative ideas coming down the pipe, we need you. We still need you. We need you to send preceptors our way. We need you to contact me as the Practicum coordinator to discuss potential preceptors or even to elaborate on how you can help. We need you to connect us with someone who may know someone who would like to be a preceptor. We need you to help us develop partnerships with additional clinics and hospital systems in both urban and rural communities across the state of Louisiana. Bottom line, we need you. As I move towards closing, I'd like to take us back to where I started. When I reflect back on when those two nurses came out to speak with the family and the charge nurse was there, I just know that that charge nurse in that moment was actualizing the summit of his profession, just what he was charged to do. Because in that moment, He was helping mold an autonomous decision-making practitioner. No doubt, that charge nurse had a preceptor that ignited something in him to give back and become a preceptor. This preceptor-student relationship provides training that can promote social responsibility in students, thereby making them desirous of becoming preceptors. It creates a cyclical effect. In healthcare, there's a misnomer.
Looks like we may have lost Hope here.
Especially in nursing, that nurses eat their young. It's not true. They actually feed their young. But what's most important to remember is that as nurses and healthcare providers, we can't always turn to be fed. We also have to turn to feed others. This is where the importance of preceptors and professional mentors comes into play. The preceptor plays an important role by guiding and role modeling their knowledge, their skills and practice to increase the confidence and enhance students' practice towards becoming licensed healthcare professionals. I want to close with reminding us that emergencies happen everywhere. Medical care is needed, whether it's acute or chronic, and it's needed all over, from rural Louisiana to metropolitan areas, from emergency rooms to community health clinics. Increasing preceptor capacity in Louisiana will not only benefit students, it will also work to address the healthcare provider shortages in communities where patients struggle to access services. Here at Loyola, we recognize that preceptors are essential to graduating highly skilled healthcare professionals and enabling them to serve communities most in need. Thank you.
Well, Hope, thank you once again for both being with us and for presenting in challenging circumstances after Hurricane Ida. We are really glad to have your insights. I would certainly encourage folks that may know of somebody who might want to be a preceptor, particularly in rural or high needs parts of our state. That's certainly where we've been partnering with Loyola and where they've been doing the most work. If you have ideas or suggestions, please don't hesitate to reach out to her. As you saw, her contact information on that last slide. And as you have questions for her, feel free to drop them in the chat. Hope is with us today. And if you've got questions for her or for our other presenters, we would welcome those in the next couple minutes. So with that, I would encourage those who are able to join us back on video in terms of our presenters. We do have a couple questions that have come in, and I will toss those to you all with the time we have remaining. Allie, let's go to you first. Can you talk specifically about recruitment in high school? So the question from a while ago was, are most of your students on the university track, or do you all also partner with students who are participating in Jumpstart or other career pathways into healthcare?
Yeah, amazing question. So BRIC is a college access program. That is our big goal. So it's no secret that the majority of our students that are with us, their end goal is to, not their end goal, their goal after high school is to head to college. However, we do support fellows who choose other paths such as military. I actually don't know about Jumpstart, and I've never heard of it is what I mean. And I'm writing that down to make sure I'm looking into that. But essentially we're supporting all high school students. To be accepted at BRIC, we are looking for a 3.0 GPA or higher. However, we do make exceptions, and then household income of 65,000 or less for the family, again, do make exceptions.
Great, thank you, Allie. And certainly to the question, I think the average BRIC student is sort of looking to become a nurse or a doctor or something of that nature, dependent upon the jumpstart roles and pathways. There could be some pipelines, there may not be. So certainly look forward to hearing questions from others, particularly thoughts if folks have them from across the state. Dr. James, let's go to you next. There was a question just really about how you all are seeking to improve from here. So certainly you all have had some great progress and good steps in the right direction. But there's still students who aren't making it all the way through. There's still areas for improvement. What's next for you all as you think about continued improvement for this work?
Well, we're always evaluating. We're always looking to see what happens next, where our students are deficient the most. And we're also looking to see where other opportunities may be. We have an accelerated program for our LPNs who are seeking to become a registered nurse. And we've just started talking about how we might be able to reach out to the paramedic to maybe offer an accelerated program for them who are looking to become a registered nurse, but not to waste all of the skill set that they have. So how we can help put them on a track to get into the healthcare workforce. And we're always looking to see what other schools are doing that may be some point of interest. We're looking at professionalism. That's one area where the associate degree nurse lacks because it's more technical. So how we can promote leadership in our and integrate that in our curriculum.
Thanks, Dr. James. And Hope, I see you're on the line with us. One question for you, if you were able to come on to video. There you are. Good to see you. Talk to us just a bit about the geography gaps and the service gaps. So certainly we know that breaks down in a number of different ways, but when you all look at gaps in preceptors across Louisiana, what are the biggest barriers that if somebody's listening and they might know somebody, you want to say, hey, if you were in this area or this topic or this focus, please give us a call.
Sure. So we look at the Hpsas, of course, and like I mentioned in the presentation that more than 80% of Louisiana is considered to be a Hpsa area, but we were focusing in on 3 particular areas, Calcasieu Parish, Terrebonne Parish, and that of Lake Charles. And those are the areas that we're really wanting to funnel students to, either those students who are originally from that area and going back into the community there, or even students. We're looking at creative ways to bring students from all over. With us being an online program, the majority of our program is online. We have students that are from all over the United States and beyond. So we're looking at even bringing those students into those critically shortage, health professional shortage areas by way of offering scholarships and as well offering room and lodging and food for them to come and complete their practicum in the area, and with hopes of them staying in the area to work. So I would not limit it to those 3 parishes, but I would definitely say if there's anyone out there who knows of any healthcare providers, health care educators who are willing to be preceptors in those areas and beyond, please to definitely get in contact with me, because this is a definite barrier to many students graduating from their programs.
Wonderful. Thanks so much. So as we come to the close here, I'll just say thank you again to Allie, to Hope, to Dr. James for your time and your insights today, for your passion for these topics. To the point you just mentioned, Hope, we talked about at the beginning, these were obviously not the normal times we were expecting between hurricanes and everything else. And as you mentioned, shortage areas that were true well prior to hurricanes. We think about Hurricane Laura of last year and its impacts on Southwest Louisiana, an area that had a shortage of healthcare providers and preceptors. We think about Hurricane Laura and its impact in the Bayou region. You mentioned Terrebonne Parish. So certainly areas of overlap, areas of need that were there before. And certainly we would encourage all those who might be interested in stepping in to meet the needs of communities to do so where they can. So I want to thank you all for a really robust conversation today. Thank you for taking the time to join us. The recording and the materials for today's session, as was asked earlier, will be shared after the session. There was a survey just dropped into the chat. Please take a minute to complete us. Just a couple questions would certainly help us shape future sessions in a much more effective way. We'd love to get your feedback. Next week, Tuesday, September 21st at noon, we're going to hear from 3 leaders addressing the fact that this problem that we've been talking about today and the topic we've been talking about over the last day or two is connected to so many others. We're going to talk about funding, and specifically how funding for preventative healthcare often lives in different places than you'd expect and how you can get access to it. We'll talk about silos, the fact that people who engage in a hospital setting may need mental health or job training or other supports, or those who engage in the justice system may actually need treatment or other support. So how do we overcome those silos? And then we'll talk about inclusiveness and diversity. As was noted today, our healthcare workforce isn't as diverse as it can or maybe should be. And certainly we see the impacts of that in terms of health disparities, maternal health, and there are a number of great groups doing work on this. So we're going to talk about those 3 topics in some depth. We hope you will join us. For now, I'll just say thank you for your time and your insights today. This is a critically important issue for our state. We appreciate you taking the time to join us. We hope you stay safe in the days to come. We hope you'll join us next Tuesday at noon to continue this conversation. Have a good day, everybody.